So gastroesophageal reflux disease, what we routinely call as a GERD, is a common gastroenterology problem we'll encounter in day-to-day practice. Most of the patients they'll come with a retrosternal burning sensation. Retrosternal means the burning sensation behind the chest, breastbone. So this is a common symptom. So almost 1/5 of our patients. So one out of every fifth patient they'll come with a reflux problem. So most of the time they will be giving history for months together or years together. So we can diagnose this problem, this common problem, with based on the symptoms, that is patient symptoms. So the common symptoms, in addition to retrosternal burning, there may be some regurgitation of the food into the mouth, or there may be a chronic cough associated with the reflux symptoms. So a patient who is presenting with this thing, most of the time we can initiate the treatment with medication based on history only. So with history only we can diagnose most of the time. When problems are persisting or a patient is not responding to a simple measures like lifestyle or some medication, then we'll investigate. The common investigation which we will do in our clinical practice is upper GI endoscopy. With this thing, most of the time we can diagnose the problem and we can assess the severity or grade the severity of the disease. Based on this thing, we can plan what is the long-term management treatment or management program. So there are various methods, or we will follow a stepwise care for the patient with the GERD. There are two approaches. One is the step down, another is called step up. Step down means usually a patient who is having a severe disease, a gastroesophageal reflux disease, if it's severe, we'll start with a drug like proton pump inhibitors like rabeprazole, pantoprazole, or omeprazole. So we'll give a standard dose of the drug. Once patient they respond to symptom wise it is an improvement. So usually within 4 to 6 weeks we will try to taper the dose, and we will try to reduce the dose over a period of 6 weeks or 12 weeks. This is called initial management of GERD, gastroesophageal reflux disease. Then subsequently we will try to reduce the dose and we will try to maintain the patient's symptoms with on-demand therapy. So whenever patient develops reflux symptoms or burning sensation, they can take the medication, say 1 to 2 weeks, and they can stop. Or next alternative, you will try to manage these symptoms with a low dose PPI. Low dose means suppose a patient who is taking rabeprazole 20 milligram, we will reduce the dose to 10 mg.